Hi guys, my name is Elizabeth Tali from Golden Events Company and I will be your host for today. Welcome. Did you know that cervical cancer is amongst the leading causes of death among women? Did you know that cervical cancer affects women across all ages? Did you also know that cervical cancer is preventable? Join us today at 11 a.m. as we hear more on this topic from the one and only Dr. Wekesa Wanjala from the Nairobi Women's Hospital. You're all welcome. Welcome everybody joining in right now as we wait for Dr. to fix his presentation. I'll talk about the topic again. Today's topic is on sex and reproductive health, and we'll be tackling everything to do with sexual health and reproductive health in both the male and the female genders. And some of the topics that we'll discuss will be contraceptives. We'll also discuss on STDs and STIs. Those are the sexually transmitted infections and diseases. We are also going to talk about the reproductive conditions in females. That is the common one. The big giant being cervical cancer, and some of the other conditions which are endometriosis, PCOS, and we also talk about the risks involved. And Dr. is having a hard time sharing his presentation. He's working on it. In the meantime, you guys can send in questions or inquiries or topics that you want to be discussed today concerning the topic or concerning the general topic of session. And the number that you can use to contact us is on 0723 566 863. 0723 566 863. That's the number you can use to contact us, send in your questions, inquiries, clarifications surrounding today's topic that you want for it to be discussed today. Yeah. For those joining in right now, my name is Elizabeth Tali and I'm the moderator. And today's event is brought to you by Golden Events Company. And today's topic is on sex and reproductive health.
My name is My name is Dorina Tola. I am the team leader. Sorry for the technical issues you've experienced earlier. We've been working towards it, and I promise you guys we'll try as much as we can to avoid the next technical error. And thank you so much for being patient with us. Thank you so much for still tuning in. And as we wait, I can say thank you.
Again, my name is Rebecca Mataza. I'm the one in charge of marketing, branding, and promotion. And this is a Golden Events Company. We are bringing to you our topic of today, sexual and reproductive health. We welcome your participation, your questions, your inquiries. Let's make this an interactive session.
My name is Kiprop Lucy. I'm the administrator, the secretary. I was producing the agendas and taking minutes. And welcome to our discussion.
So you've heard from the other members of the Golden Events Company. The Golden Events Company is the company in charge of organizing today's event. And again, today's topic will be on sex and reproductive health, and we'll be tackling issues to do with contraceptives, issues to do with STDs and STIs, issues to do with reproductive conditions, conditions like cervical cancer, endometriosis, and PCOS. I can maybe go through some of the questions that will be answered today by our medical practitioner, who is Dr. Wekesa Wanjala, as he tries to figure out a way to share his screen so that the presentation can begin. I can maybe go through some of the questions that will be tackled today, answered today by him. And some of the questions include how often should you get a pap smear? What exactly is a pap smear? What does a negative pap test result mean? And what does a positive pap smear test mean? Who needs to get a pap smear and how does it work? How much is a pap smear? What are some of the facilities that somebody can go to be able to get a pap smear done? Also, we'll discuss about the HPV vaccine. What is the HPV vaccine? Who is eligible for a HPV vaccine? How much does it cost to get vaccinated against HPV? What is HPV? I'm sure some of you have had some of these common terminologies, but we are going to get in depth into actual facts concerning this, and we'll hear from a true and actual medical practitioner. And we'll also talk about the cost of the vaccine, the facilities that one can go to be able to get the vaccine, the HPV vaccine, and from what age should one get HPV vaccine. And we'll also talk about the benefits of the vaccine, that the vaccine stop infertility. Also, does the HPV vaccine have any benefits? What are the myths and misconceptions surrounding the HPV? And the HPV vaccine is basically the HPV virus is basically the virus that is responsible for causing cervical cancer among women. And I can maybe share some of a few facts about as we wait for the study to be able to share this. Cervical cancer is one of the leading cause of death among women. It affects women of all ages. And unlike prostate cancer, men, whereby you may find that prostate cancer, it's very common in men in the ages of, in elderly men in the ages of 50 going on to 78. Unlike prostate cancer, cervical cancer affects women of all ages. It does not matter if you're young, it does not matter if you're old, anybody can get cervical cancer. And cervical cancer is caused by the HPV virus. And most cervical cancer cases are actually preventable. It can be prevented. And how is this prevented? How is cervical cancer prevented? Cervical cancer can be prevented through the HPV vaccine. And the HPV vaccine, it can be administered through, it can be administered to both genders, both male and female, and from the ages of 9 going up to older women. Yeah. Also, cervical cancer, I've got to mention, it's the only type of cancer that can actually be prevented. I'm sure most of you have heard of other types of cancers, but most of these other type of cancers, they don't have a prevention, they don't have a vaccine, nothing can be done to prevent the cancer. But in the case of cervical cancer, it can be prevented, and it can be prevented by the HPV vaccine. Those are just some of the few insights that I'm sharing with you today that the doctor will be able to expound on. Also, if you have any questions concerning any topic or any matter of sexual health, you can send your topic to 0723566863 and we'll be able to answer. The doctor will forward the questions to the doctor and will be able to answer. Also, if you have any questions, you can just ask the questions on the live right now. You can feel free to just unmute and ask.
Again, thank you guys for staying tuned and being part of this discussion. One of the topics that we want to tackle is contraceptive or contraception. And as we wait for Daktari to be able to share his screen and presentation with us today, we can start by discussing the various forms of, bearing in mind that our topic today, brought to you by Golden Events, is sexual and reproductive health. So we can start by interacting and getting to understand the various forms of contraceptions that we have while we wait for Daktari to come on board and expound on that. Karibu sana Daktari. I can see you're trying to share your screen.
Hello guys, sorry for the issues. We are sorting it out. I'd like to answer some few concerns about sexual and reproductive health and contraceptives. Could you just repeat the ones that were placed forward?
You can maybe expound on some of the female reproductive conditions. For example, we have a very common condition known as PCOS. We also have endometriosis. You can maybe take us through some of the information. For example, what causes PCOS? Who is eligible to get PCOS? Do people get PCOS from birth, or is it a condition that just develops as you grow? Also, maybe we can talk about the painful period and the relation to painful periods and endometriosis. Do they relate? Yeah.
Pardon, the first condition you said was?
The first condition is PCOS. It's a common condition.
I'm losing you.
Women, mostly in women. PCOS.
I'm losing you.
It's a common condition in women.
Now I can hear you better.
Am I audible?
Yes, you're now audible.
You can hear me right now? You can hear me?
Yes, I can hear you. Yes, I can hear you.
I was talking about the condition called PCOS. You can maybe enlighten us about it. For example, how does one get PCOS? Is it a condition that one is born with? How does it develop? What are the causes? Yeah.
Okay, the first one is PCOS. The second one was
the second one is endometriosis, and the relation and what relationship does endometriosis have with painful periods? Like, do they relate?
all right. So the first one, let me start with the first one, which is polycystic ovarian syndrome. In short, we call it PCOS or PCOS, as you said. So PCOS is a genetic issue. First, it's in ladies because they're the ones with ovaries, of course. Then it is polycystic ovarian syndrome. So the ovaries have cysts. Cysts is like a cavity that is either fluid filled or filled with air. Okay, so in the ovaries, so you have a lot of these cysts, which now occupy the major part of the ovary and impairing the functions. So the ovaries usually give the female hormones, the ones that make females female. Okay, so when you have these cysts occupying most of the tissue that's supposed to be producing the female hormones, then you have reduced level of these female hormones, and now you the person in another term, in a layman's term, will say is less female. Okay, so it is a mutation mainly in the genes, and it causes the person to secrete less of the female hormones, so they'll display mostly the male features. So you'll have one of the main symptoms that is displayed is infertility. Okay, so infertility, the female doesn't have the balance of hormones that are available to make pregnancy and conception possible. Then they don't have the hormones to make conception possible, and the hormones to make the pregnancy to be sustained until term. Okay, then the other one will be display of male features. Okay, so like females will have growth of hair in the male pattern. They'll have beards, chest hairs, sometimes even they are very their behavior is male-like. You see them having male feelings because they don't have the female hormones that direct the female pattern. Okay, so the condition is the condition can be inherited and it's genetic. Okay, so you if you are not born with it, you can't acquire it. All right, but we can control the symptoms by giving the hormones actually. So we give the hormones, and then we give medication to bring down the male features. With some of the symptoms like infertility, that those ones we can control with giving hormones. The other ones, like the male features, like growth of male pattern hair, those ones the hair is there, so we target to remove the hair first, and then we control the hormones. We give the hormones, the female hormones, which will prevent the formation of the male pattern growth of hair. Okay, that's a little bit about PCOS. So it's usually not a single syndrome. It's a syndrome. A syndrome is usually a disease pattern that involves many organs and many other diseases. Okay, so when you have polycystic ovarian syndrome, there are other associated syndromes that may come with the syndrome. Okay, so we have kidney issues like cysts in the kidney, liver problems. So when you suspect that you are a female and you have male features, the first thing is to go be seen in the hospital, and then the complete panel will be done to evaluate the extent and which other organs are involved, so that the management is holistic. Okay, number 2 was about endometriosis. So endometriosis basically means when you look at the female genital organs, you have the vagina, then the cervix and the uterus, and then the tubes that lead to the ovaries. Okay, so in the inner lining of the uterus, you have the the lining called an endometrium. The inner lining is the endometrium. The muscular layer is called the myometrium. Okay, so the inner layer, the endometrium is the one that is shed during menstruation. Okay, so when you have endometriosis, that means the inner layer has grown into the muscular layer, or across the muscular layer into the peritoneum. Sometimes you have the endometrium being at the wrong place. For example, in one it was in one of the celebrities or had the endometrial tissue in the lungs. Okay, so every month she has menstruation with the hormonal changes and the shedding of the endometrium. She has lung issues. You see, so it is cyclical. All right, so the pain comes. The pain is increased when you have endometriosis because of the invasion of the other organs apart from the inner lining of the uterus. Okay, so in medical terms we call it dysmenorrhea. So the pain is too much during menstruation. Even the common painkillers that usually relieve the pain are not adequate. All right, so the management is usually supportive. We try to support. We try to control the pain, hydrate, and such. Then we have medical management, where we give medications to try and control the menstrual cycle, the effect. Then in severe cases, we proceed to surgical management, where we actually go and dissect off, remove, we cut off the endometrial tissue from where it is, be it the lungs, be it the liver, wherever it is. So when we get it off, we sort of bring an end to the cyclical monthly shedding of the endometrial tissue. Okay, have I answered the question? Any other clarification?
Yes, you have answered. Maybe you can talk about cervical cancer. And okay, this is it's general information. I am yet to prove it with facts, but maybe you can enlighten us about the HPV virus and its relation to cervical cancer. And maybe talk about the tests that one can go through to check and see if maybe they have symptoms of cervical cancer or not. That is the pap smear or the pap test. You can maybe enlighten us on that with facts.
All right. So cervical cancer is cancer of the cervix. As I had said earlier, in female, because they're the ones with the cervix, the genital tract. So we have the vagina. So the cervix is the gateway between the vagina and the uterus, where this is the womb, where the fetus sits, the baby. So cervical cancer is cancer of that gateway that usually is caused by a virus called human papilloma virus, or HPV in short, HPV virus. Okay, so human papilloma virus, there are several strains of the same virus. Okay, so there are 3 strains that are associated more. They are more virulent. They are more aggressive, causing the cancer. Okay, so You might have the others, but they won't cause the cancer. They'll cause other issues like warts, genital warts, genital sores, but they won't progress to cause the cervical cancer. Okay, so the tests that we do to diagnose cervical cancer mainly is called a pap smear. That's the commonest test we use around. So the pap smear is we just take a swab. Like a swab is like you just hold on something and then you touch on the cervix, the inner surface or the outer surface, and then we go look at the cells. So cancer is usually the cell is usually dysgenesis of the cells. The cells are not conforming to the normal growth of cells, and then they die. So cancer cells are like immortal cells. So when we get these cells on the cervix, the ones that are immortal, we now know that we have cervical cancer. So the management of cervical cancer will tell us, will basically be based on the stage. So the grade, there's something we call the grade of cancer. So grade is how aggressive. How is it aggressive on the normal tissues of the person? And then we have the stage, is how far it has gone from the cervix. That is from the cervix, the organ itself, and then towards the other organs surrounding the cervix. Okay, so the management will depend on the grade and the stage. So the stage mostly will result in us giving either how extensive the surgery in removing the cancerous tissue will be. So will it be partial hysterectomy or total hysterectomy, where we remove a lot of the part of the reproductive organ of the female tract? Okay. Any other clarifications I've not done?
Maybe you can tell us how long should somebody take pap smear? Like after how long since your last pap smear? That is, maybe if it's once every year, twice a year, thrice a year, what would you recommend? The number of times people to take a pap smear. You can also enlighten us on the results of the pap smear. For example, what does a positive pap smear test mean, and what does a negative pap smear test mean?
All right. So the pap smear test, the frequency of doing the pap smear test depends on actually the risk of getting this the cervical cancer. So when the risk is high, for instance, for sexual workers or those ladies ladies who are very active, sexually very active. There's active and very active. Okay, so depends on how the client feels. You see, sometimes you have a client who wants to do it every year, but the recommendations from the guidelines is 3 years from the age of 21. Every 3 years, it just go do a pap smear and get the results. So the results is either positive or negative. So a negative result means that there are no abnormal cells. Abnormal cells were found from the swab that was taken, from the sample that was taken. Okay. Then when you have a positive test, that means there are abnormal cells seen from the sample that was taken. So when you have a positive result, that means now we have to evaluate more. So we look more into the cells now, which type of cells, how aggressive they are. So we go more into specializing to the character of the cells and to see the grade now, how aggressive they are, so that we tailor our guys so that we tailor our treatment to
Sorry for that, Dr. Continue.
All right, I was actually finishing. Okay, so the frequency depends on the client, but the recommendation is every 3 years. So when you get abnormal cells, we now go deeper into evaluating the character and then the extent. We might now need to do even imaging to see how far the cancer has gone. All right.
And maybe tell us how much will it cost for maybe somebody who has never done the test before and they want to try out the test, and also some of the hospitals and facilities that carry out the test, and also does NHIF or NHIF is the most common medical cover. Do they cover the test also? Yeah.
All right, so the test is actually in most of the hospitals, most of the health centers and hospitals have capacity to do the test. Okay, so and it has been done actually in very many of our colleagues and our daughters, our parents. So we actually have good data on the on this test. So the hospitals offering are we have as I had said earlier, Mata, the Nairobi Women's Hospital where I am currently, then the major hospitals in Nairobi Hospital, Aga Khan, and Kisha, name them, just to name a few. Okay, we don't offer them in Agatul Children's Hospital. Okay, okay, so the scheme, the covering, the insurance scheme, NHIF, unfortunately doesn't cover the test. The pap smear test, but it depends on the scheme you're using for NHIF. There's the general, the regular, and then we have the civil servant NHIF, and then we have the police scheme. So it depends with the scheme and the specifications. Okay, so generally they don't. Okay.
Daktari, I have a question.
Yes.
It is said that men are the ones who carry the virus, your cervical cancer. Does it mean the number it can be found in any man, ama it's just specific?
All right. So the male species, the male species are the carriers actually, because it's asymptomatic most of the time in men. So we don't know if we have it. So the ones that bear the brunt are the female species, because the presence of the cervix. Okay, so the men carry it with together with the other human papilloma viruses that cause genital warts. Okay, so the main symptoms of HPV is in men is usually the genital wart. So on the penis you'll see the mounts, the warts. Okay, so we usually don't know it's asymptomatic in men, but they carry it, and when they have unprotected sexual contact with females, then they transmit it to the cervix, where it now causes the cervical changes, the changes on the surface of the cervix. Okay, so men, it's difficult to tell. So the main thing, there's no specific characteristic that says that this man has, this man doesn't have. So it is usually just to use the barrier methods in during sexual intercourse. So condom being the most important, but it's not 100%. The condom does not protect you from from human papilloma 100%. Okay.
So, thank you so much, Daktari, for answering our question. Before we go to our next session, I'd like to thank all of you who are still tuned and part of this discussion. And as we had promised, we have a gift to give, courtesy of one of our service providers, Safaricom, who are providing us with this net and this multimedia channel of communication. So we have giveaway gifts, we have giveaway scratch cards, and I'm going to randomly read out a scratch card number. Scratch card, we have different scratch card vouchers worth different amounts. So I'm going to read the first one, which is worth 100. And I'd like everyone who's part of this discussion to try and load in this airtime. So the number is 2983 08 40 2922 8326. I repeat, 2983 0840 2922 8326. And this is strictly for our joint guests. My fellow administrators, you're not supposed to take part in this. Kindly please, if someone is our lucky winner of our first gift, please speak up.
Rebecca.
Just unmute your mic and let us know.
I think I'm the winner. Alfred.
Wow. Alfred Kiplagat.
Yes.
Oh, karibu sana. Thank you. And guys, stay tuned. We have more and more fabulous gifts to give away. So our next point of discussion, Daktari, we want to address the best option for different health conditions in regards to contraceptive. We all know there are various forms of contraceptive nowadays. women have different options to choose from, depending on their body types, their hormonal imbalances, their body changes. So we are not going to really discuss the types or the effects, but we specifically want to know the best option for different health conditions. For instance, is it safe for women maybe who have specific health conditions, say cervical cancer, say these common sexually transmitted infections or UTIs in women? How safe is it to be on this contraceptive in relation to the myths out there that there are specific conditions that when a woman under, she's not going to be able to access or be able to utilize contraceptives effectively so that they work to serve her best interest. So kindly please tackle that wide topic, but narrow it down to the best options for different health conditions in different women when it comes to contraceptives.
All right. Thank you, Rebecca. Golden, could you please use just put the slide presentation? I'll have a look at the slides, the presentation, and then we'll now go to the specifics. Golden, slide presentation, please. You're still on down here on your right, please.
Doctor, is it the STI one or the contraception one you wanted to tackle?
Let's start with the contraception. The contraception, this one, the one you're displaying.
Okay, let's start at page 1.
Golden, down on the right, there's a slide presentation button. Just click it. Down. Go to the right. Go to the right. There. No. Right. There. Yes. If you clicked it, just click it. It's not working. Is it? It's all right.
Meanwhile, Dr. you can just start by taking us through the different types as we wait for the slide presentation to come out.
All right. So contraception is usually prevention of conception. Okay. So contraception basically involves two parties, the male and the female. So just preventing the sperm from getting to the ovum or the ova to fertilize it. Okay, and that's conception. Okay, so basically we have several types of contraception. Usually we divide them into double. It's either permanent or temporary. then is either hormonal or non-hormonal, or so when you have permanent contraception, that means it cannot be reversed. Okay, so once it's done, it's done. Okay, so these permanent ones are usually surgical, have tubal ligation, where as we looked at the female genital tract, we have the vagina, we have the cervix, the uterus, and then you have the tubes, the fallopian tubes that lead to the ovaries. So tubal ligation is usually just ligation, just occluding, tying off the fallopian tubes. So basically when you basically when you ligate the tubes, that means the sperm won't go through, or go through towards the ovary to meet the ovum, and the ovum won't travel down to meet the sperm on the way. Okay, so that's in females. In male, it's called vasectomy. So we cut off the tubes that come from the testicles that bring sperm towards the penile tract and into the female genital tract. So these are permanent methods. When you do them, you do them. The other one could be what we called hysterectomy, where the uterus and part of the vagina, cervix, and the other organs are removed. Okay, so when you remove the genital tract, there's no way you'll return it. Okay, so these are permanent methods. Okay, so then we have the temporary methods. So the temporary ones, that's where we have now the either hormonal or non-hormonal. So the hormonal part of the contraception is when the client is given tablets that contain the hormones at different concentrations to discourage either ovulation or to disrupt the early the attachment of the zygote after fertilization, to disrupt the attachment to the uterus and the growth of the fetus. Okay, so these hormones usually just disrupt the balance, the normal balance. So we make the balance abnormal, so that it is hostile to the zygote that has been fertilized. Okay, so the non-hormonal types have the barrier types. So the most common barrier is the male condom. Okay, the other one is the female condom, then the cervical cap, where you put a barrier, you put a gate on the gate, you put a padlock on the gate, so sperm won't go through the cervix towards the uterus and the fallopian tubes. Okay, then we have the intrauterine device, and there are two types of the intrauterine devices, IUCD in short. You have the one that is has been made with hormones in it, and the other one that is just the copper wire. Okay, so the one with the hormone in it is more effective, but is we have the other one that doesn't have hormones, because there are ladies who experience very severe symptoms or complications when their hormones are made abnormal or imbalanced in view of the contraception. Okay, so basically those are the main types of contraception that we have.
Also, we know that with us young people really are not familiar with most of these contraceptives, the long term, and they don't want to go for them, you find most of the youths, they run towards using the emergency pill, the P2, to prevent pregnancy. And personally, I know that the P2 is not a contraceptive. Maybe you can enlighten us on the long-term effects of the P2 and yeah.
All right. So P2 or steno-2 is an emergency contraceptive. It's an emergency. So you can't have so many emergencies until you're taking P2s almost every 2 months. So when you take P2, when you take P2 more than 3 times a year, then know that you are tipping the balance of your hormones to the other side. So P2 usually plays with the hormones to try to make it hostile for implantation of the zygote after conception, or to prevent conception. So when you tip the balance so many times, sometimes the balance will just tend to be abnormal. So the long-term effects of P2, one of the commonest is infertility. So the hormonal imbalance will just be imbalanced now after that onwards. Then the other one would be ectopic pregnancies, where the pregnancy is located outside the uterine cavity, which will not be sustained. Okay, so the other one will be the other complication like pelvic inflammatory disease when you have the previous the previous ectopic pregnancies with the complications. Then you might go to what we call pelvic inflammatory disease, which is now a disease that comes from the genital tract of the female and is a complication of the genital tract issues. Okay, so conception is meant to disrupt conception or prevent implantation and growth of the fetus. Okay, so depends on how early the conception is taken. When it's taken late, when you have implantation, then now we're talking about abortion. It's not contraception. Okay, so about 6 days after sexual intercourse and the conception, you have now implantation of the fetus. So after that, basically what you're doing is abortion, not contraception.
Okay, thank you for that. I think we have addressed the topic of contraceptives, and now we can move on to our next topic, which is on STDs and STIs. Yeah. Okay, before we move to STDs and STIs, I'll open the floor for questions. Does anybody have any questions or clarifications concerning the topic of contraceptives and contraception that they'd like for the doctor to answer? You can just either unmute and ask.
Hello.
Yes, Paul.
Mine is a question. I'll have to take you back slightly to PCOS because
Right.
we were never given the floor to give our questions. So yeah, how is the severity of PCOS? How bad can it get? Is it painful? How is it?
All right.
That's it.
So, okay. So PCOS is not painful per se. So the issues come from the secondary manifestations of the syndrome. Okay. So one is psychological. Okay. So psychologically, when the female sees that she has beards, she has growth of hair on the chest, then she's breaking her voice and she's not conceiving, that means she's infertile, then the issues now begin. Okay, so you'll have psychological issues being more severe. So sometimes they usually need psychological support. Okay, so the other one will be now the medical issues. Depends on the organs affected. If you have the liver affected, you'll have issues with the liver functions, like cleaning of the toxins from the body. Now you'll have toxin buildup, so the body will be what we say toxic, not cleaning the toxins well. Have production of several compounds from the liver being impaired. Then you'll also have the liver breaks down some chemicals to make them less harmful. So you'll have buildup of these chemicals like bilirubin, and the liver also acts like a volume reserve for blood. So when you have very little changes in blood, like dehydration, you've not taken water for 2 days, you'll have manifestation of these symptoms being more pronounced. When you have issues with the kidney, you have urine output. You won't be the person won't be producing urine normally as expected. Then blood pressure might be low or high depending on the part of the kidney affected. Then you might have the cysts even in the intestinal system, in the gastrointestinal system, which might cause intestinal obstruction, or impaired absorption of certain nutrients, depending on the level of occurrence of these cysts. Okay, so basically the severity depends on the organs affected and the mental stamina and the support around, the social support around the person, the family and the friends.
And are the changes drastic?
So the changes are not drastic. The
Yeah,
changes
for
are
instance,
basically
go first.
so the changes are not.
Yes, Paul, just speak.
Oh yeah. I'm asking whether the changes are drastic. Like, can you be 25 and then you figure out, oh, you had PCOS now? Probably then is when you're gonna break your voice.
So the changes are not drastic. They are slow. So the bad thing about being slow is that you discover them late because you've sort of acclimatized from before. So when you're breaking the voice, you don't recognize it immediately. So it takes time, even the people around you, to tell you, no, hey, hii sauti yako it's deep. Ama it takes people, unapatana korev ndio naambiwa, hey, na sauti yako ni mzito kama the honesty in drunkenness. Okay, so it's not drastic, it is slow, because there are changes that take in the body, which will display at adulthood.
Oh, okay. Yeah. Thank you so much.
Any other questions, please?
Going forward.
We are still taking in questions.
Dr. can you hear me?
Yes, I can hear you.
Yeah, so there's someone here in the comment section going by the name of Brenda B. She's asking, how can someone decide what contraception or combination of contraceptives to use that is the best for them?
Okay, thank you for the question. Actually, it was focused on something that was on a blind spot. So in deciding which contraception to use depends on what the person wants. Okay, so one is, how long do you want the contraception to be in place? Okay, do you want it to take place for 5 years? Do you want it to be permanent? And how comfortable are you with it? Okay, so if you want it permanent, we have the surgical ones, the ones that have resection of the tubes. If you want a long-term one, we have the implants that will give you either 3 years. They'll give you a duration of contraception you want. Maybe you want to have contraception for 3 years, then you conceive. So depends on how long you want the contraception. How comfortable are you with it? Are you comfortable with the bricks when the method is being removed, or are you comfortable with the speculum? That's when you have the vaginal examination and putting in of the IUCD. Are you comfortable with the barrier methods, the condom? The others that say that the condom inatoa feelings then disrupts the flow of things. So depends on how comfortable you are also.
Yeah, okay. I think that answers that question correctly.
I have another question. Since you've mentioned the barrier method, the condom, my question is, does double the condom double the protection? Like when somebody wears 2, does it double the protection, or yeah?
No, in terms of contraception, it doesn't. It's actually a risk. See, the condom is lined with a gel that usually makes it reduce the friction. Okay, although there are condoms that are called Rafaida, those ones. Okay, so in having one is adequate to prevent contraception, because there's no sperm that can penetrate the condom. That's simple. So when you have 2, you'll have friction of the inner condom on the outer condom, so you might have them busting. So without knowing, you might be preventing when you're not preventing. So 2, not recommended, because of the friction between the 2 condoms, which might result in them busting and rendering the method of contraception ineffective, or actually not there.
All right. Okay, thank you so much, Dr. for answering all these questions effectively. To keep our audience active, I'm coming back with another scratch card. to give away. So guys, stay tuned, and I won't say the worth of this scratch card. Could be 1,000, could be 5,000, could be 500. The first one was worth 100 though. So I'm just going to randomly read out the number, and this is specifically for our guests, our audience. My fellow administrators, this is not for you. So the number is 3892693687912458. I repeat, 3892693687912458. I'd really like to know who won this gift card. The lucky winner.
I did, Rebecca.
Paul. Oh, Paul Mweni.
Yeah. Thank you so much.
Guys, stay tuned. We have lots of giveaways to hand out, so stay tuned to the end.
Do we have any more questions before we go to our next topic? Okay, since there are no more questions, we can move to our next topic, which is sexually transmitted infections. And mainly there's HIV, among other STDs and STIs. Dr. You can take us through the common ones.
Are we able to share the presentation, or I just proceed?
I think you can just, it's better we just proceed to save on time.
All right. Okay, so let's continue on this sexual journey. We'll avail the slides and to those ones who want to have a look at them, then we'll take from there. So, sexually transmitted infections. So the outline of my presentation is I'll look at the definitions, and then we'll differentiate between STDs and STIs. That is sexually transmitted diseases and sexually transmitted infections. We look at the causes and the types. Then we look at the risk factors. What will make the person be at risk of getting an STD and an STI? We look at how they present, how the person feels, the symptoms of these diseases. And then we look at how we make a diagnosis, how we find out the person has the disease and how we treat. Then we will finally look at the complications. What would lead to, these diseases and infections will lead to if left untreated or if inadequately untreated. Okay? So, STIs, initially we used the term STDs, which are sexually transmitted diseases, and basically is diseases that are transmitted through sexual contact. So mainly through exchange of sexual fluids, or even the genital organs touching. Okay. So the difference between the infection and the disease is that the disease is full-blown. So you see symptoms very, they can be seen from afar, or the person feels that they have issues with their genitals. But the sexually transmitted infections involve the diseases, but it covers also the ones that are asymptomatic. We don't have the symptoms. Okay. So, which are these common sexually transmitted infections and diseases we know? Someone?
The most common one is HIV.
Anyone else? The common STDs and STIs. Anyone else?
Herpes.
Yes, herpes.
Syphilis, gonorrhea.
Yes, syphilis, gonorrhea.
There's
HIV.
herpes. Herpes, some of herpes. Herpes.
Herpes. All right.
Chlamydia.
There's HPV.
Yes, there's chlamydia. And the commonest in women? The commonest that can even be cyclical.
Oh, UTI.
No.
HPV.
From the genital tract.
Yeast infection.
Urinary tract infection. It's UTI. Which one is
Yeah, someone said yeast. Who said yeast?
Yes, I did. Yeast infection.
Yeast is
Yes.
sexually
Yes, it's one of the commonest genital tracts in female. It is not sexually transmitted, but we usually put it under sexually transmitted because sexual intercourse impairs the pH, the level of acidity and alkalinity, and being basic. Okay, the level of acidity in the vaginal tract, which now predisposes to the fungal infection, thrush or yeast.
Then I have a question based on the same. Just
Okay.
a slight clarification. Is there any difference between the sexually transmitted diseases and the sexually transmitted infections? I'm led to think the diseases are the more chronic ones, and the infections are the recurrent but easily treatable ones, like maybe the UTI and such. Just like to
Kindly
know
repeat. Kindly repeat. You're not audible enough.
Okay, my question is, can you hear me?
Yes, I can hear you.
Yes, my question is there any difference between STDs and STIs, the diseases and the infections? Because I remember at some point I was attending some health seminar, and the emphasis was that the sexually transmitted diseases are the more chronic ones, while the sexually transmitted infections are the easily treatable ones. So is that really true, or are they one and the same thing?
So the definition was let me say half true. Okay. So sexually transmitted infections is everything of the above. Okay. So when you have the sexually transmitted infection being severe, causing symptoms and the impairment of the sexual acts, and even causing pain around the groin area, then it's sexually transmitted disease. It is the severe form of the infection. So the infection involves the mild ones and the severe ones. Okay. So so STDs is part of STI. So STI is the umbrella. Satisfied?
Yeah, thank you for the clarification. Yes,
All right.
we are still on the more questions from STIs and STDs. The preventive measures, causes. Yes.
All right. So the causes of sexually transmitted diseases and infections are usually dependent on the cause, on the primary issue. So one could be the bacteria. So bacteria is one of the organisms that causes sexually transmitted infections. Then we have the viruses, and then we have the parasites. We might also have the sexually transmitted infection being caused by the healthcare worker. Okay, so in this case, we have the healthcare worker using medical equipment that is unsterile, that is not clean, has not been cleaned and was exposed to this these organisms, bacteria, virus, or parasites. Okay, so we call it iatrogenic, caused by the healthcare worker or the person with the STI. So you have the cultural practices, then medical practices, and the personal practices. So you'll tell me about the cultural practices because you know more, you know them more than I do. Then the bacterial causes are the gonorrhea, syphilis, and chlamydia. The previous two being the commonest, kaswende na kisonono. Okay. Then the viral STIs causes are HIV, herpes, and then HPV, have hepatitis B, and then the rare ones are we call cytomegalovirus or CMV in short, and Zika virus. And then you might also have infestations, insects around the pubic region, have crab, the lice, chawa, and then scabies. Okay, so those are the causes, and these causes will only be manifested into an STD and later progress to severe form, which is the STI, manifest into STI, then progress into the severe form, which will now be called an STD, when the following risks are the person is exposed to. If the person had a previous sexually transmitted infection, or if the partner the person is having intercourse with has a very severe form of sexually transmitted infection, or the person has multiple sexual partners, or the other one could be inconsistent condom use, then drug abuse, which will predispose the person to making irrational decisions. So which are the symptoms that you guys know about STIs, either in men? Let's start with men. In men,
We are welcoming your participation, our audience.
Maybe for the men, I can say painful when you pee, you feel pain. But yeah, I'm not sure since I'm not a male. For
Correct.
the women, I can say in the case of a yeast infection, maybe itching.
Other signs and symptoms that any of you is familiar with or has heard of? I can talk of the case of a UTI. There is severe abdominal pain in some cases, not in all cases.
There's also for women the abnormal discharge, whereby there may be odor or discoloration on the discharge. But these are just like general assumptions. Maybe Dr. you can clarify on the facts.
All right, excellent. So, for the men, very correct. So, one is genital warts. Okay, so have growths on the penile shaft and part of the perineum, growths on the skin. Okay, this could be an indication of STIs. Then others have ulcers or sores. Okay, then could also have discharge from the urethra, the entrance of the penile shaft. Then the could also have pain and tingling, itchy sensation, the groin area and the penis itself. This is why you see some men with their hands in the pocket most of the time. So, and when you're and some of them are just scratching. They have itchy, tingling sensations in the groin area, that's the pubic area, and they're trying to just relieve the itchiness. Some have swollen testicles. This could indicate sexually transmitted infection or a more severe case where the testicles have twisted, so it actually calls for rapid evaluation and management of such. Then the others could also be a manifestation of the disease itself, affecting now the whole body, which are fever, loss of appetite, and then being generally weak, malaise, call it lethargy. Then in severe cases, you might have rectal pain from the rectum or the area of the anus. Okay. On the side of women, they also present with itchy genitals and anus. They experience pain while passing urine. So both genders will have itchiness and pain while passing urine. They might have both also have blisters or sores or rash. Then both will also have a discharge. Then For the female, we'll have basically bad odor. It's true. We have we have the clients complaining of bad odor, or maybe for the ones who are married, wanasema mzee ameanza kucheza nje kwa sababu hawezani na the environment. Okay. For ladies also, and to a small extent in men, wanapata ile tunaita pain while in the act, during sexual intercourse. So in medical terms tunasema dyspareunia. So when you have these symptoms, you should first do not diagnose yourself, because when you diagnose yourself, that means you'll go treat yourself and buy medication for yourself for the condition. So first is to investigate which is the specific
Oh, okay. Thank you, Daktari, for that. We are welcoming more questions from our audience. Any question concerning STDs, preventive measures, treatments, before we move to our final part of this discussion?
As the
May I
questions are
have a
coming
question?
Yes, Daktari?
as the questions are coming in, I'll be taking two at a time. Okay, so
Okay.
let me just touch on diagnosis,
Okay.
and how we treat.
All right.
Okay, so diagnosis, usually we look at the symptoms that the patient has come with. Pain, discharge, which type of discharge? Is it blood, or is it yellowish? Does it have a smell? Which smell? Most of the time in ladies, they say a fishy smell. Okay. So we then proceed. We have a provisional diagnosis. So we then proceed to do the investigations. So the investigations will depend on the severity of the symptoms. Sometimes the symptoms are so severe the person can't walk. So that means we have to do more vigorous or rigorous investigation. Okay. So we take urine, blood, and then the discharge. If there's discharge, we take a swab. We sample the discharge and go test it to know specifically what is it, this discharge. Okay, that could also be the key to treating the infection. So in treatment, the major thing is usually prevention. When you prevent, we don't have anything downhill. We don't have a disease. We don't have complications. So unfortunately, if there's acquisition of the disease or the infection, we start with supportive management, which is usually medical and psychological and social. Okay, so in medical management, we treat the diseases according to the causes. All right, and then we control the pain and the other surrounding symptoms. If there's fever, we control the fever. Then in very severe cases, we might need to do surgery, especially in genital warts that are so huge, they're impairing even the sexual the sexual event. Okay, you're told that this lady akiona huyo msee ametoa hivi, akona watu kubwa, hiyo anatoka mbio. You see, if this one is very traumatizing even to the man mwenye ameachwa hapo amehang. Okay, so we might need to do surgery, and there are different types of surgeries that are done. And then most of these STIs don't affect only the genital part. Have the syphilis that affect even the heart. Okay, syphilitic heart disease. So when it's untreated, might progress to heart disease, which is very hard to manage because the changes that come with the complications of syphilis infection in the heart are very severe. So in case of hepatitis, it affects the liver. So when the liver is so much affected, hepatitis can lead to hepatocellular carcinoma, which is liver cancer. And in this case, we might need to transplant to give the person a new liver. So the complications are several. So usually come from the condition being untreated or being inadequately treated, or the condition was not even discovered until the complication arose. So we have ectopic pregnancies, have cancers, then psychosocial issues where the person is affected socially. They can't interact well with the people around them because of the condition they have. Then you have for ladies, you have the infections even infecting the child during birth. So when the child passes through the birth canal, the vagina picks the infection, and then this affects their lives. And some of the infections are very severe, like syphilis. Will even affect the child's heart, as I had said earlier. Okay. So basically, in summary, we've talked about definitions, STDs and STIs, and we've differentiated between STDs and STIs, saying STI is the umbrella term, and if an STI is so severe, we call it an STD. Okay. Then we look at the classes, the causes, and the risk factors. Look at the symptoms, how we diagnose and treat, and the complications. Remember the risk factors: multiple sexual partners, inconsistent condom use, contraceptive, the barrier methods, the severity of the infection of the other partners if not screened, prior history of sexually transmitted infection, and alcohol and drug abuse. Okay. All right. Thank you.
Daktari, I want to talk about hygiene and well-being. An example, if I have a roommate and she has STI or STD has developed an STD, can I get infected when she's not practicing proper hygiene?
Can't get you well. There's so many mics on. There's so many mics on. I can't get you well.
My question was about
Yes.
health, the health well-being. For an example, I'm living with a roommate. She is infected with STI. She's not practicing proper hygiene. See, I will be infected because she's not practicing proper hygiene. So I'm asking, if you're staying with a roommate and she is not practicing self-hygiene, what can you do so that she cannot transmit the disease to you also?
So the best thing would be to to try and help her practice proper hygiene, to prevent sharing of fomites, of sheets, towel. There are people who even share their underwears. So when the person that had worn it before shed some of the infective fluid in the underwear or the sheet or the blanket, and then it gets to your genital area. Then that's it.
Thank you
You're
so
exposed.
much. As for now, we'll invite questions from other members apart from the participants of this event. We are allowing the audiences to ask some questions. From the beginning to the end, what you've understood, what you've not understood, what you need to be clear, anything you can ask for the time being, then Daktari will answer you.
In the meantime, my question is, there is this myth that goes around that says that peeing after sex, it's mainly believed, it's a belief mainly spread around women, that peeing after sex, it helps to prevent any STDs and STIs. Is that true?
Good question. Okay, so peeing after sex does not prevent the person getting an STI. It can prevent the person from getting a urinary tract infection. So urinary tract infection is infection in the urine tract, and sexually transmitted infection is infection in the reproductive tract. Okay, so peeing after sex will help clear the particles or the infection that was at the entrance of the urethra. That's the exit from the bladder, but it won't prevent STDs and STI.
Okay, thank you. Another question is, can you get STD and STI if you don't have penetrative sex?
Yes, good question. So you can get, yes, you can get an ST. Let's use STI, which is the umbrella term. You can get an STI if not practicing penetrative sex, because some of these are transmitted only by contact, like HPV. That's why I said even the condom won't be effective, because if the wart is on the around the pubic hair, and the pubic hair touches the other pubic hair, so there's no barrier between them. Okay, so the other sexual practices that are not penetrative, like oral sex, so the person, if the person has syphilis, you'll get oral syphilis or throat syphilis. Person has gonorrhea, they'll transmit, you'll have gonorrhea around the throat and the mouth. Okay.
Okay. Does anybody else have a question concerning our entire topic? There's also one question. There's this common method called the withdrawal method. Now my question is, if the withdrawal method is also known as pulling out. My question is, does pulling out protect you from STIs and pregnancy?
All right. So pulling out sounds like a song. Suppress. Okay. So pulling out is part of the improvised natural family planning. So one of the things I didn't talk about was natural family planning, because it's not very it works in those with regular menstrual cycles, but sometimes you won't tell if next month's cycle is regular or not. So counting days. So pulling out will only protect the people from pregnancy, but it won't protect from STIs. But sometimes the pulling out is not effective. Before you pull out, some things have some semen has filled in. So and there are people who say that pulling out is you see, it's not very enjoyable. You want to finish and finish. Okay, so depends on the on the effectiveness of the person pulling out.
Okay. And another question is, will there always be symptoms with an STD or an STI, or maybe you can get an STD or an STI and not have any symptoms?
Okay, good question. It's sort of a clarification from the previous presentation. So there will not be always symptoms with an STI. So if there are no symptoms, it's an STI. If there are symptoms and it's affecting the sexual character and the sexual life, even the physical life, then we have an STD.
Okay, thank you for that. Are there any other questions from the audience? You can maybe unmute and ask, or you can type on the chat box.
Okay.
Dr. will be able to answer.
Hello, guys.
Hello.
Mine is not even a question, but rather a compliment. I'm enjoying how you're answering the questions. They are very detailed, and I'm being informed, and I'm grateful for that. Thank you so much, Dr.
Thank you too for listening.
Okay.
We are coming to the end of the session. Thank you for all of you who have stayed throughout and have not left. Thank you for your time. And we are still open for questions, but we are rounding up by 1:30. The discussion should be over. So anybody with a question? And also we have one more credit giveaway. So don't leave, guys. We still have one more airtime to give. I will not mention the amount. It will be a surprise, but there will be a credit giveaway. So anybody else who has a question, you can just unmute and ask, or type on the chat box.
Dr.
Yes, Paul.
Yeah, one last question. Judging from the dynamics and what we've talked about generally, I'm figuring out that that you can't really, if you're big on safety for both parties in terms of the whole sexual act and the whole process, it sounds like you can't be safe enough. So how can you ensure it's safe for you, for both of you now?
Okay.
Because you mentioned the inconsistent use of protection can be detrimental. The plus lack of it notwithstanding, plus a whole lot of things. So how can you be safe? How can you ensure yourself?
Okay. In ensuring your safety, it's a two-way street. The person, the lady has to be committed to ensuring your safety, and you have to be committed to ensuring your safety. Okay, so number one is if you have a partner, stick to one. Okay, then Uh, saying so, I saw someone smiling. He said, "Stick to one." Okay, so stick to one and be faithful to that one. Okay, so then if you decide to use if you're not, if you don't trust the other partner, then using the barrier methods will give you some protection, and it would also reduce the chances of you giving infections to the other partner. And then for me actually the major thing about any illness is how well your body can handle disease. Okay, so how is your immune system? Is it always ready, up to par with diseases? Do you have any other diseases that will dial down your immune system? Okay, so basically it is a discussion between two people. Kama huwezi stick to one, tumia protection, lakini ujue sio 100%. Okay, all right,
thanks.
Daktari.
Yes, Golden.
Yes, one last question.
Yes.
Gabriel Mungai is asking, what is the function of pubic hair in preventing transmission of STIs, and is it advisable to shave it all or leave it?
Okay, so pubic hair has no function in preventing STIs. Okay.
Yeah.
So the only thing it could do is delay. So for example, when you have when the person has let's say HPV, so it won't be immediately transmitted from skin to skin because of the pubic hair. Okay, but the pubic hair doesn't protect from getting an STI. The function of the pubic hair is mainly temperature control around that area. Hapo kuna kwanga moto. So okay, on a lighter note. Okay, so the pubic hair controls the temperature around the pubic region because you see it's hidden. Okay, so what you need to do is for aesthetic, that means how it looks. If you think it's too bushy, you can reduce the length. Unaweza shave kidogo kama vile watu walikuwa wanakuwa nyolewa na makasi, but shaving it all off will now predispose you to even higher risk of getting an STI, because during shaving you get small cuts on the skin which are now opening up you to even the little infections that the skin could control. Okay, and also you could also have the hair piercing the skin around the pubic region, then you get like small boils, those ones you see, and when they burst they still expose you to getting an STI. Okay, so keep the pubic hair, keep it short, keep it clean. Okay,
Nice answer.
There's also one audience asking,
the difference between a yeast infection and candidiasis. What's the difference between candidiasis and yeast infection? Candidiasis.
All right. So yeast infection is just the common term for candidiasis. Candidiasis is the scientific name of the fungal infection that causes the yeast infection. Is called Candida albicans. So the disease is called candidiasis.
There's another one, the last one. It's does PCOS have an effect as severe as being advised not to engage in sex, or its related effects? PCOS. PCOS.
All right. So PCOS has no contraindication for sex. You see, the organ is there, the lubrication is there. It's all right. The feeling is there, the mutual feeling is there. PCOS doesn't affect that. So the only thing that PCOS will affect is the hormone release during and the feeling during sex. So sometimes the lady with PCOS will get dry faster than the one without. So they might need lube or lubrication, KY jelly. Okay, but that means they have to interrupt the sex and look for KY jelly, and so that they continue. So the only thing is there's no contraindication for sex with PCOS.
Okay, thank you for that. Maybe I have another question. And my question is, okay, there's this information that I read somewhere recently that says, as women, when we are born with all of our ovaries, like all of our eggs. Now, there's also this myth that says using contraceptives over time can make you infertile. Now, maybe you can clarify on that. And are they like related in any way? Is it true?
Yeah, they are cousins. They're related. So, sorry. The thing about ladies are born with a constant number of eggs or ova. So, with every cycle shedding without getting a baby, that means you're shedding one. You're shedding the ova. So and the best ones are shed earlier during their 20s. So hizo zingine wale wazee wanakuja baadaye, si wazee wanakujanga later. So with advanced age, the quality of the eggs declines. So that means the children conceived during these times either have congenital conditions, or they're not as bright or as intelligent or as fast as the ones that were born during the earlier years. Okay, so so usually there's actually the best year for a lady to get the brightest child. Okay, you can guess which year is this, when they are how old?
18 to 25.
I need 1 year. Is it 18 or 25?
22.
It's 24. Even for men, the most energetic and the best sperm is produced at 24 years.
I'm sure most of us didn't know that.
But unfortunately, these ones are wasted. Hizi watu wa kunyonga, ama inaitwanga nini? All right.
So for us who are 27, hope it goes kind of.
27 does not decline. The rate of decline in men is not as fast as female. So even at 70, it has not declined so much, but it has declined, of course.
Okay, guys, we are coming to the end of our session, and we have one last scratch card giveaway. It's a huge amount. That's the only thing I can say. And I'd also like to thank all of you for staying tuned all through. Your comments, your questions, your participation is highly appreciated. Daktari, pia tunakushukuru sana for finding time and coming on board to discuss this very wide and effective and necessary topic, especially among the youth. So we are seeing your comments coming in. Gabriel Mungai is saying thank you. The platform was nice. Mishi, I see your comments. You're saying thank you for the platform. It was very helpful and educative. Asanteni sana, guys. So I'm going to read out the last scratch card. All the best. So,
Yeah, so
2 1 6 5 1 7 5 7 1 3 7 8 7 1 3 5 2 1 6 5 1 7 5 7 1 3 7 8 7 1 3. Who's our lucky winner?
Anybody who has the airtime? Maybe we can read the airtime number again.
Okay.
Okay, I've gotten it.
Who is it? Brenda B.
Yeah.
Okay, karibu sana.
Okay, thank you.
We've come to the end of this discussion.
Before we conclude with our moderator, I'd like to welcome my fellow administrators on board to at least introduce themselves one last time, and they give their very brief remarks, then we wind up. From myself, I'm Rebecca Mataza. I'm the marketing, branding, and promotion manager. Yes, I'm the one in charge of the marketing of all this event. So thank you so much, guys. God bless you for making time to be part of us.
my name is Randy. I was the event host for today's meeting, and I'd like to say thank you to all who made their time to join. It was a pleasure.
This discussion was brought to you by Golden Events, an events company, and I am Elizabeth Ntali, the moderator and in charge of programs.
My name is Dorina Tola. I'd like to say thank you so much for your patience. Thank you so much for staying with us. Thank you so much for making time to join us today. I am the team leader, and I'll say thank you. I appreciate everyone in this group for participating, and I'll say asanteni sana.
Thanks for your time. My name is Kiprop Jeserem Lucy. I was the administrator, stroke the secretary. Thanks a lot.
Thank you everybody for tuning in, for making time. We have come to the end of the discussion. A big thank you to Dr. Wekesa Wanjala. Thank you. I'm sure so many people have gotten a lot of insights from today's discussion. Like, I'm sure most of you guys who are here, you have left with a lot of knowledge concerning so many things, and at least now the knowledge comes from a practitioner, so you know it's facts and it's true. So whenever you hear any rumors or myths around there, you'll be able to distinguish between the truth and what is just myth. Thank you, Daktari, so much for making time. And you guys are free to leave.
Thank you for taking your time to be part of this discussion. I hope you've gained much insight. I've been your host, Elizabeth Mutali.
And I've been your marketing manager, Rebecca Mataza.
I've been your secretary, Kiprop Lucy. I have been the team leader, Dorina Tola.
And this has been
a Golden Events production. Uniquely golden.
Behind the
golden
scenes.
Events. Check.
Okay. No.
Oh my gosh. Oh my god. Behind the scenes.
Acha kusquat. Really high inside. Don't listen to my
Who's the most hardworking in the group?
hii video ya kuchomea so nitapost.
Ni wewe.
Mtu mzuri tumesema wewe, mbaya ni mimi na do.
The latecomers is Becky, Doreen.
Nani ni kierere?
Who's the most beautiful?
Sasa mimi nimebebana.
Sindio, that's why it's called behind the scenes. Hatuko prepared.
Tunafanya
Nataka tutembee aje ndio. Hivi.
Enda, Tiago. Yeah. Exactly. Penduka hivyo.
the events, lakini sasa tunakaa tu tume. Scripted. Imeandikwa unique. It's unique, it's gold.
Uniquely good.
Unajua hivi kwa ingine mimi naambia
We should bust a move, guys. We should bust a move. We should dance.
In 3, 2, 1, go.
Hi guys, my name is Elizabeth Mutali. I'm here to welcome you to the next episode.
3, 2, 1, go.
Hi guys, I've been your host Elizabeth Mutali.
And I am Rebecca Mataza, the marketing manager.
Too slow.
Join us today as we hear from Dr. Wekesa from Nairobi Women's Hospital. Did you know that cervical cancer affects women across? Insightful. I've been your host Elizabeth Mutali.
And I've been your marketing manager, Rebecca Mataza.
I've been your secretary, Kiprop Lucy. I've been Doreen Atola, your team leader. Nimesahau. Rudieni tu hapo.
Mataza.
I've been your secretary, Kiprop Lucy. I've been Doreen Atola, the team leader. Aki, mi siwezi